Hey, good afternoon. My name is Dr. Adam Starks, and I'm the proud founder of Mender, a digital village for foster and at-promise youth to address the youth mental health crisis. Today, our system fails over 97% of foster youth. And in that number, we waste billions in lost productivity. When they age out of the system, they're either jailed or they end up homeless, or we're paying for them through substance use disorders. And as a result of this decades-long trend, the foster youth have become the most over-medicated youth demographic in the U.S. So what does that mean to succeed as a foster youth? Finishing school, becoming self-sustaining, and contributing to society, and most importantly, breaking the cycle. None of us can do it alone, and my lived experience is proof positive that it can't be done alone, despite my story of overcoming. And thankfully, that child you see before you today was a success story thanks to his community. How did they do it? In essence, it was community. It was getting food security. It was my education, which was my saving grace, and eventual economic stability and access to healthcare. Right now, we're trying to solve a puzzle, but it's not really a puzzle. It's so much more complex than that. It's really a Rubik's Cube. And what we're doing right now is essentially spinning in circles as we operate in silos. What we can do What we need to do is operate together under the social determinants of health umbrella. And that's where Mender comes in. Mender starts with when a youth or their caregiver downloads the app, they will be introduced to our conversational AI bot, Mindy, and given a social determinants of health screening. Mindy will ask a series of questions and make sure that they can get access to the resources that they need. And while they are being referred, they will have access to our digital therapeutics hub, where we've partnered with Lucid, a digital music therapy app, which has been shown to alleviate depression and anxiety, two of the most prominent mental health ailments that youth are suffering from today. In addition, they will be able to access our community services. That is powered by findhelp.org. We partner with them to navigate through the difficult channels of finding anything from rental assistance to transportation, or even job training and legal assistance. At the press of a button, it will be able to essentially help them navigate through eligibility checks and filling out the difficult forms that our bureaucracy has put in place as a hurdle. And lastly, we have online peer support, which is powered by Discord. So I'm incredibly excited about what this has to offer for families, helping keep the youth at bay while we get them the professional help that they need. And this is evident and needed because it's taking anywhere from 3 weeks to 6 months to get a mental health professional for youth, which is unacceptable. And for Menders, which you'll see a description of Menders down below, Mender acts as a digital Swiss Army knife of sorts. With a closed-loop AI referral system, we're able to orchestrate the social processes necessary to tell the full story of what's going on with that youth. Right now, what's happening and that high failure rate is due to youth falling through the systemic gaps that exist in our system, not due to lack of caring or lack of good work that's going on out there, but the operating in silos is the part of the puzzle that we need to solve. In terms of our competitors, you'll see Unite Us, which is the industry unicorn, nonprofits iFoster and eSINs. They offer a variety of social determinants of health features, but none of them offer anything that's AI powered. And Mender comes with a closed loop AI navigation system and AI guided 24/7 support, which is absolutely crucial because the reality is most of the crises that occur within a youth life or a foster family's life happens outside of business hours. So if we're going to solve this Rubik's Cube of sorts and optimize Mender, we need every player within the pediatric and child welfare space to operate together, communicate with one another, and coordinate services and resources. So our target customer includes healthcare organizations, um, public service agencies, including nonprofits, and school systems where youth spend a third of their day. Right now, as I showed our competitors, they're not really involved in the school systems, and that is an absolute critical piece for counselors, school psychologists, and teachers as well. Now, this is easily scalable. I told you the story about the foster youth, but this is easily scalable to the 12 million at-risk youth that currently reside in America. That includes 600,000 in the juvenile justice system, 500,000 foster youth, and the countless millions who are deemed at risk. And that market is estimated at $54 billion, with our share being $95 million within 5 years. We want to serve at least 200,000 foster youth and 20% of at-risk youth in Title I schools, which are largely overlooked. Our business model includes a one-time onboarding and implementation fee, which varies depending on size and population size and the entity. For annual subscriptions, we offer a flat rate price to healthcare organizations that going from the systems all the way down to the independent clinician or pediatrician. We have a 5-tiered pricing system to ensure affordability and balance that with business sustainability. We have a 5-tiered pricing system for social service departments or public service agencies, schools, and nonprofits. Our current stage right now, we have verbal intent from a variety of universities, health or children's health systems, and departments of social services. Our greatest strength is our partnerships. We're linking, we're not necessarily building anything new. We're putting everything together. All of the good ideas that exist right now, we're linking them together via API with our partnerships. You'll see here Lucid, as I mentioned before, and we'll have more within our digital therapeutic hub, Hive, which does content moderation, and of course, fundhelp.org. Milestones right now, we have the MVP available on Android, iOS, and web, and we are a public benefit corporation. And a recent, as of this week, Founder Institute grad. All right. Our team consists of myself with my lived experience and PhD in organizational leadership, and 15 years of business experience, including one other business venture, and my chief clinical officers who will oversee the evidence-based practices that we will use, and our COO. I'm also working with a variety of agencies that offer fractional services to keep costs down as we begin our startup process. Our key performance indicators will, of course, be active users, organization types, satisfaction scores, and addressing mental health disparities by community, and of course, patient outcomes. Our current stage, again, I wanted to highlight that we do have 300 active beta users, 50 organizations within the app, and most of our traction coming from Pittsburgh and Washington, D.C. Our roadmap, I won't go into too much here, but I do want to show you that with that funding, we're hoping to enter the healthcare, social work, and nonprofit market, followed by federal, state, and municipal contracts, and exiting within an 8 to 10 year time frame. So we are asking in this pre-seed stage, we're asking for $500,000 to finish development, pilot test, and go to market. Thank you for listening.